You'd think the only symptom of a heart attack is chest pain, right? The answer is no. Heart attacks vary extremely in how their symptoms manifest. And because 1 second could be the difference between life and death, it's vital to recognize the symptoms quickly. There have been some who ignore symptoms that ultimately proved fatal. Since no one knows what will happen in life, let's protect ourselves with knowledge. Hello, this is Physician Supervised, Preventive Medicine TV. Today we'll talk about the 3 symptoms of the worst heart attacks. A myocardial infarction or heart attacks happens when suddenly the blood vessels to the heart are clogged, and blood cannot pass through to the heart. People with high blood pressure or lifestyle-related diseases, diabetics, smokers, and people with a family history of heart-related illnesses should be especially aware. When you think about a heart attack, most people imagine a scene where someone's crouching over in a cold sweat and sudden chest pain. This is certainly a common symptom for most heart attacks. However, in reality, there are cases that do not show as extreme chest pain. In these cases, unfortunately, most people ignore the pain or stay home and wait it out. From watching this video, I hope that you can get to the hospital quickly in the case of an emergency, and that as many people as possible can receive the best treatment. And if you've had an episode of similar symptoms, please let us know in the comments. With that said, let's get to it. By the way, this channel provides evidence-based medical and health information from a doctor's perspective, so I think it would be helpful to subscribe to the channel. The 3 signs of the worst heart attacks. The first is shoulder pain. Question: if your shoulder hurts, do you think about going to the doctor? If you answer, of course not, hit the like button and show us how you feel. Now look at some real cases. One night, a 50-year-old man was watching television when suddenly his left shoulder started to hurt. It's probably just stiff shoulders. He waited it out for 2 or 3 days. Eventually, he became more and more out of breath and unable to move. His family called him an ambulance. The examination revealed heart failure due to acute myocardial infarction. As in this case, heart attacks can actually manifest as shoulder pain. Why would it cause shoulder pain? The human body's peripheral nerves attach from the heart to the shoulder. This shoulder pain originates from the heart and radiates to the shoulder. The heart is on the left side of the chest, but the pain can radiate to both sides. So it doesn't mean you're fine just because the pain is in your right shoulder. How do you tell it apart from normal shoulder pain? You should be wary of pain that doesn't seem to go away even when holding still. The 3 signs of the worst heart attacks. Number 2 is upper back pain. It's even more important to pay attention to this symptom. Here's why. One cause of heart attacks is a condition known as aortic dissection. In this condition, the aorta, which runs through the center of the human body, is at maximum risk of bursting at any beat. When the aorta bursts blood vessels, returning blood to the heart may also burst or clog, causing a heart attack. Many people with aortic dissection experience back pain as a symptom. That's why doctors are very cautious of sudden back pain in outpatient departments, in case it's aortic dissection. A man in his 40s was riding his motorcycle when suddenly his back started to hurt. The pain wouldn't stop, so he went to the hospital to find he suffered a heart attack due to aortic dissection. Since back pain may not only be a sign of a heart attack, but may also signal aortic dissection. Let's think of back pain as a serious symptom. The 3 signs of the worst heart attacks. Number 3 is vomiting. During a heart attack, the part of your brain which controls vomiting may become stimulated and cause nausea. You don't usually imagine you've had a heart attack after throwing up, right? Usually, nausea is caused by the foods we eat or gastroenteritis, but you should be especially careful of sudden nausea without a known cause. If this happens with chest pain, you will likely notice you are in a dangerous state. However, those with diabetes or nerve damage may not experience any pain from the start. Since those with lifestyle-related illnesses and smokers are at higher risk for heart attacks, I recommend lowering the bar a bit when considering visiting the hospital when exhibiting vomiting. Today, we discussed the lesser-known symptoms of heart attacks. If you have any concerns about myocardial infarction, please feel free to comment. That's all for today. We look forward to seeing you again.